Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm one of your hosts, Dr. Jonathan Weiler, a board-certified plastic surgeon, been in practice for over 15 years. And I'm going to introduce you once again to the lovely Taylor Besh.
I am Taylor Besh, have been working alongside Dr. Weiler for a long time now with
Almost
Weiler
15
Plastic
years.
Surgery.
We met a long time ago.
He is our expert today. We are going to be diving deeper into the submental area. So
Yes.
the submental area is this lovely area below your chin that we all, it drives us a little bit crazy. And there are tons of options, but we're going to focus in on non-invasive, invasive options, but mainly submental lipo.
Right. Your classic double chin, right?
Double chin. What is the double chin?
So I would say in my mind, there's sort of two categories that people complain about. One is just sort of genetics, where you're 15, 25, 35, even getting into your late to mid 40s, where it's a collection of fat. Genetically, your body collects fat there first, right? You may have a skinny little body, be in perfect shape, but damn my parents, they gave me this double chin, right? And you've got this collection of fat beneath the skin. And we'll get into fat cells in a second. And then the second is an aging process. People call that a double chin too, or a turkey neck. That gets more into turkey neck. We're not really discussing that today. That's more of a aging process. So I would say what we're focusing on is our younger patients, patients in their 20s, 30s, and mid to early 40s. Once you get beyond your 40s, into your 50s, it becomes more of an aging process. So the double chin is really a collection of fat. It can be a little bit of lax skin because there's so much fat there.
I feel like especially since the Ozempic boom.
Yes.
People are saying it's a double chin, but it could be skin only.
Could be skin. Could be skin only. So collection of fat below, we call it the submental area for those of you that are watching. It's really centered through here. Most of it's genetic programming. Fat cells, I tell patients, are like storage balloons. They collect and store energy. In some patients' bodies, genetically, the fat cells that live in this area below the chin area collect fat first. So if you have an extra 3 pounds on, some of that fat's going to go right there, and it's going to make you look disproportionate to the rest of your body. And it's a pretty common problem. It's gotten a whole lot more common with cell phones, selfies. Those of you that were working or, streaming during the pandemic, right? All those, lower shots, it really accentuates that area. So it's a hot topic. It really is. It really is.
Treatment-wise.
Right.
Non-invasive treatment. Submental lipo, in my opinion, is the gold standard for this area because it's the quickest, easiest recovery. But
it is. There's lots of options beyond that.
Beyond that, what are your favorite options? What's the best?
So if you said, hey, what is the ultimate non-invasive? That would be cool sculpting, right? There's a couple of different devices out there that remove fat, but cool sculpting is the granddaddy of them all.
Or maybe we should say cryolipolysis.
Cryolipolysis. Let's not use the brand name. I'm going to get a bad, nasty call from somebody else. But let's use cryolipolysis. And essentially cool sculpting, that's the brand name. What it does is it removes fat cells by freezing the fat cells. It is truly non-invasive, which means you go into the clinic, and we've got lots of them. You walk in, they place it on your skin. The device essentially sucks that fatty part with the skin into a sort of concavity of the device, and then it freezes those fat cells very quickly. As those fat cells thaw, that process can take anywhere from 15 to 45 minutes. As those fat cells thaw, they're storage balloons. They literally explode. And then the lipid, which is the fat inside, goes into your bloodstream and is absorbed and excreted by your liver. And once those fat cells explode, they're permanently gone. Now, it doesn't explode everything. You're not going to feel a popping sensation.
Right.
This is a process that occurs naturally. There's a little bit of discomfort right after the procedure, mild discomfort. You can have a little bit of mild swelling.
Mild swelling, yeah.
A little bit of mild pain. But it truly is non-invasive. Nothing breaks the barrier of the skin. 2
treatments?
Typically 2 treatments. Some patients need 3 treatments. Very skinny patients may be happy with 1 treatment, but most patients we say need 2 treatments. It's been around for 10 years probably now, and I think it's a legitimate solution. It's not my go-to because I'm a surgeon, right? And probably not your go-to when
No.
you talk to patients.
Yeah.
But it's out there. We use it. Patients are very happy with it. It is truly non-invasive, and it can work really well in certain. It's all about selection with a lot of these.
Yeah. So moving on from cool sculpting, the next would be more in my realm, deoxycholic acid.
Yep. We'll brand name it, right? We'll call it Kybella.
Kybella. So Kybella we see a lot.
It's been around for how long do you think, Taylor?
Probably 12 years.
12 years? No.
Yeah, early on.
Really?
Yeah, 10 years. Maybe I'm wrong.
I'd say
Sorry,
8 to
Allergan.
10. Yeah, I think 8 to 10.
So deoxycholic acid, same concept, except for it's done with an injection.
Right. So it does break the skin barrier.
That's right. So sit in the chair. We put a little grid on your skin. Inject. It's like a little henna tattoo. Inject the area. It takes probably 3 minutes to do. The injection of deoxycholic acid causes exactly what we said. I say that the cool sculpting forms icicles inside of the fat cell, basically, and it pops the fat cell and then your body absorbs it. Deoxycholic acid actually melts or takes away, it's called apoptosis, the fat cell membrane, and then your body absorbs it, same thing. That process causes a great deal of inflammation.
Correct.
So
That's
they are
the one problem with it.
swollen like a bullfrog for 48 hours, which I say embrace the swelling, but sometimes people don't have that downtime.
That luxury, right?
Yep. So that would be Kybella. Usually, 2 to 3 treatments as well, just like the cool sculpting.
Right.
Next thing I would say, which a lot of people do not understand, is even the lack of projection of the chin. And if you address that without even addressing anything here, I think that is becoming more popular non-invasively, is just putting volume in the chin and jawline to camouflage
Putting
the
filler.
submental.
You're talking about putting
dermal filler.
Okay, so putting filler to camouflage the fullness.
Absolutely.
Okay, so that's more of your realm. I don't see a whole lot of that. I do think, like you said, I do have a lot of patients coming in talking about jawline aesthetics, and obviously fat below the chin area, below your skin, throws that off. So I do see a role for revolumizing, or not revolumizing, but volumizing the jawline, right? And so as a surgeon, I do chin implants.
Chin implants, right.
Anatomical chin implants. I am not a fanatic about them. Some guys are. Some people, every time they do a facelift, they put a chin implant. I don't believe in that. I think it's cheating, number one. But there are you shouldn't do that. Obviously, it's going to make your jawline better.
Right.
But it also makes some people have giant chins, because not everybody needs a chin implant. So, but for those that need it, and I am getting more aggressive with it, I think it's a fabulous tool to use to really establish an excellent jawline. I use an anatomical chin implant, so it's not a little button. Tom Selleck, I don't know if I'm a little older, remember the Tom Selleck, the classic dimple and the powerful chin. But people think of a chin implant with that because he has such a strong chin. But an anatomical chin implant goes really from, we'll call it the jowls, all the way across. So it fills
better contoured rather than just a bump right here. Yeah.
And I really think it works well, and it really can camouflage, because like you said, some people come in and they don't necessarily have a whole lot of fullness. It's more of a weak jawline, right?
Absolutely.
And more in your realm, you're putting filler in that area,
Yes.
right?
I always say try it on. We usually end up with a chin implant with Dr. Weiler, one of our surgeons, but it's a good non-invasive option. Next thing, let's move on to would be soft wave.
Okay.
Soft wave, give us a little spiel about that.
So soft wave is focused ultrasound energy below the skin. So anyone that's probably watching this podcast may or may not have an ultrasound. An ultrasound is really just waves, electronic waves, energy waves that go in and they bounce back and they create a picture. That's what people think of it. An ultrasound is used to look below the skin in your body. Well, what this company figured out is that if you take those waves and you focus them and pinpoint accuracy below the skin, it can do two things. It can tighten tissue, and it can also help melt fat. Now, it is primarily, in my mind, a skin tightening, a non-invasive, which means doesn't penetrate the skin. In other words, doesn't go through the skin like a needle. It's outside the skin like cool sculpting. It's primarily, in my mind, a skin tightening device. But
side
can be
effect
used.
if you can, change
Yeah,
the
you can
settings.
focus that energy and melt some fat, basically blow up, apoptosis, melt, whatever you want to call it, those fat cells, and you can disintegrate some fat cells. So there are devices out there that use this type of energy to remove fat cells, and you can do it in the area below the chin. And that is also an area where people can get, because they had so much fat, some skin laxity. And that's where we start rolling into what happens, if you roll in our clinics and you're 22 years old and you simply have a roll of fat underneath your chin, but you've got 22-year-old skin, well, removal of that fat alone is often good enough. That skin will retract very nicely, right? If you come in and you treat them with Kybella, if they come into our clinic and they treat them with cool sculpting, we select those patients typically to have very nice tone and texture of their skin. So once that fat's gone, whoop, it snaps right back up.
Right.
Now, I'm a little bit older. I'm in my 50s. And when patients come in and let's say they're a 42-year-old person that's lost a whole lot of weight, but they still have that collection of fat down here. And not only do they want fat removed because they want a better jawline, and let's say they have a fantastic chin, but they want that skin to tighten, that rolls into better or different modalities. And that's kind of where you get
that fits in.
Yeah, that fits in, is a focused ultrasound. Now, we primarily use it for skin tightening, but it also does remove some fat. And that process, that's a procedure done by our estheticians. They're all under medical guidance. It's usually 2 to 3 treatments.
2 to 3,
right? We do it. We do offer, topical numbing. We can even do it under some sedation. We have the ability, because of our nurses and our anesthesia, CRNAs, to do that. It can be a little bit more of an intense procedure. I've personally had it done. I am more for skin tightening. That's the way it's being used on me. I love the device for that. I think it is by far the best non-invasive device to tighten the skin down there. I'm not a huge fan for removal of fat. If you're 20 years old, 25, 30, and you've got submental, a little fat roll below your chin, and you're looking to get rid of that fat, you got great skin tone, that is not the device for you. It's more in the older categories where that works better. No downtime.
No downtime. That's the beauty of it.
Which is amazing. The procedure can be a little more intense. You have to be, some people get a little sedated. I didn't just topical, and my wife's much tougher than me. Women are much tougher
I heard that we
than me.
heard a couple of curse words during that procedure.
But I made it through it. So, but I hadn't done my second yet. So but it can work.
Non-invasive. Obviously, we have a large array of options. From Kybella, cool sculpting, soft wave, chin augmentation. Still, at the end of the day.
Let me ask you this. What about these at-home exercises you see?
Oh, gosh.
So people come in and.
Okay, so I feel like that was the 1980s trend of clenching, accentuating, working out the platysma, which I call baloney. Do you have is there any truth to that?
No, there's no. So the problem is, it's not because the platysma weakens, it's because the platysma actually separates and falls as you age. So remember, the platysma, and we're talking platysma, that's the muscle beneath the skin on the superficial surface of the neck, is why you develop neck bands. That is different than fat below the skin. So fat below the skin is what we're specifically focusing on. Could you exercise your body, lose more weight in general? Yes. But most people, it's a genetic curse. They can't get rid of it unless they starve themselves, literally. What you're focusing more, or people think about, hey, can I exercise it? You cannot get fat. You cannot work fat away
from the area
by just exercising that muscle there, right? So if you had a fat bicep, you can't just go home and do curls all day, and the fat's not going to go away. Your bicep will get bigger beneath it, but it's going to look even worse because you're going to have fat on top of a big bicep. So that theory does not go. And the at-home electronic stimulation devices,
the rollers,
the fat rollers, those don't work. Now, those can temporarily improve the appearance of like cellulite, things like that, primarily by causing swelling. But they do not remove or improve the appearance of a full chin.
What about neck creams?
They're not going to remove any fat, right? But they can legitimately tighten the skin for a few hours, I think. Do you? I mean,
I do think that there is true skin crepiness, elasticity. But as far as the actual fat, they do
Right.
have one on the market that says that it does remove the fat, and
Oh, really?
only to place it on this part and not here to get rid of the fat. I have not seen
No, I can't
truth
believe
to that,
Yeah.
but I do think it helps the skin a little bit.
Yeah, I do. I think there's certainly creams that can help the skin long term and short term.
Yeah.
Both ways. But they're not going to get away that double chin, right?
Right.
They may tighten the skin a bit, but you're still going to have that fat. So really, what we're talking about is what's the best way to get rid of the fat?
What is the best, easiest, quickest, honestly, financially the same aspect? And it's submental liposuction.
Yes.
I would say majority these days of my patients that come in for a submental consult, and we talk about every option, majority of them end up having submental lipo.
Yeah, I agree. It's the gold standard.
What is submental liposuction? What does it entail? Give me a step by step.
All right, so let's talk about liposuction and I'm going to give you the same spiel I give my patients. Liposuction is a very simple concept. So I like to do this under a local anesthesia, which means no IVs or no tubes. I give my patients a combination of two medications called Ativan and Valium. They're both a potent sedative. People do take Valium for nerves.
And that's
Ativan.
by mouth. You
By
just
mouth,
take a little
it's an
pill.
oral pill. You take it an hour before you arrive for your procedure. Some patients, that's all that they get. Some patients do need an additional pill once they get to the clinic. We'll put you on a monitor. We do this in the operating room. Even though this is local, you'll get no IVs or nothing. I tell patients that type of medicine at a certain quantity will put you to a state of just total relaxation, almost like you've had a few too many drinks, but you're still functional. We will literally walk you back into the procedure room. And we're focusing only on the submental area, right? So it's a small area. So then we tumesce that area.
What does that mean?
All right, so tumescent fluid is a very dilute combination of lidocaine, which is a numbing medicine, and epinephrine, which is a medication which tightens your blood vessels and decreases bleeding. We use a needle. We put that beneath the skin. That's the only thing that you're going to feel. And so once we numb that area, we're protecting that area. We then prep the skin, which means we use like an antibacterial soap or a cleansing solution to clean the bacteria off the skin, because we all have bacteria in our skin. Then I make a small incision. Almost everybody has a natural little crease right behind their chin. The incision's around 1 centimeter wide. It's very, very small.
I always say the end of my pinky now.
Yeah.
It's tiny.
Oh, yeah, it's a good
Tiny.
It's a good one. And then I use a cannula. So we're going to numb that area. A cannula is a hollow metal tube with a blunt tip. We then go beneath the skin into the fatty layer. So you have your skin, then you have your fatty layer.
Hollow metal tube.
A hollow metal
with a
tube.
blunt tip. Sounds a little scary. So it is about the size of.
It's about the size of my pinky, too, to be
Okay.
honest. It's about the same size as the incision. So it's very small, smaller than a pencil.
Smaller than a pencil.
Smaller
There
than a
you
pencil.
go. Okay.
Smaller than a pencil. It has a small little opening on the side, and it actually has a little bit of a reverse cutting blade on the underside of it that's well protected. Sort of like I'm not going to make that reference, but almost like a little blade
Helps
on
it glide.
Yeah, it helps it glide,
It's
but
like safely.
it also helps sort of skim off fat.
Yeah.
Right? And so we're entering the space between the skin and the deeper muscle, which is the fatty layer, which is all that fat is living. Okay? We go into that layer, and then it's very simply, we just kind of suck it out. I know it sounds crazy, but it's that sort of cannula, which is a hollow metal tube, a very small hollow metal tube that has a blunt tip, connect that to a suction device, and we simply just remove the fat. The fat is just sucked out. Sucked out. It is slightly cut, and it's hard to explain how that's done in a very safe manner. But once it's slightly cut and then sucked, and it's then removed. And the process has been around, liposuction has been around since the 60s. It's very safe, very well proven. And it can be, in the right hands, very, very effective. It's obviously a skill. You obviously want to go to somebody that knows what they're doing. I'd recommend a board-certified plastic surgeon who does a lot of facial procedures. It literally takes us the preparation takes time, the numbing takes time, all that takes time. The actual process itself takes around somewhere between 5 and 10 minutes. if people watch it online, we'll probably cut a little caveat, caveat of us doing this. We're going to have some pictures. It can look a little rough, but it's also actually pretty elegant. It looks a whole lot rougher than it is, especially in the submental area. We'll make an incision here, and sometimes we'll make little incisions behind the ears to really establish that jawline, right? It depends on where people are collecting that fat. Now, the one issue is that what we talked about depends on the category of patient.
Okay, I was going to say, a little bit of excess skin.
Right. So people come in and, they've had weight fluctuations, right? They have a little bit of skin laxity, mid-30s, and they want that chiseled jawline. We have to add something to tighten that skin. Liposuction alone, if you've got good skin, will give you an excellent results. But if you have stretch marks, if you have skin issues, if you have very thin skin, if you have older skin, it's not going to snap back. So that's where we start to use skin tightening devices.
At the same time as the liposuction?
At the same time. Which, when we say at the same time, we will at the same session.
Yeah.
So we'll liposuction first, and then we use our skin tightening devices. And there's a lot of them out there. We've been through a bunch. You hear people talk about, skin tightening devices that you place on the skin and heat the skin. I'm not going to name names. I don't think those are great devices because the problem is you have to deliver enough energy beneath the skin into that deeper tissue to heat the tissue up.
To cause skin contraction.
Right.
So after you do this procedure, the submental liposuction, obviously you have one stitch where the cannula is inserted. What does recovery look like? How do you complete the procedure?
All right. So recovery is quick. Now, if we are just doing submental liposuction, we'll put one stitch in each little area. So you may end up with 3 stitches, one right here and one behind each ear. We'll wrap you up in a compression. We like to use Coban, which is it's a sticky self sort of elastic bandage. We wrap you up. We provide an ice pack. You're numb because we've numbed you up with that tumescent solution. You'll be numb for about 6 to 8 hours. So always tell patients you're going to talk like this for a little bit because your lips are numb. Your face will swell that first day because we're trying to prevent a whole lot of swelling here because that wrap is firm. So it does push a little swelling to the face and to the lips. That evening, elevate, relax. We provide an ice pack on and off. Don't ice continuously, but ice on and off. And we'll see you back in the clinic the next day. When you come back into the clinic next day, we're going to unwrap you. We're going to make sure things look good. It is a surgery, and that's what people have to understand. This is not cool sculpting. This is not Kybella. This is a surgery. So every surgery has a slight risk. Anytime you penetrate the skin, right, you always worry about infection. You can worry about bleeding. You can worry about injury to arteries, veins, or even nerves if you're in the wrong plane or position. That's why it's important to go to a board-certified plastic surgeon.
Right.
Skin tightening devices that we use we use one that goes beneath the skin after we liposuction and heats from beneath the skin. That heat causes skin contraction. That can cause damage to arteries, veins, and nerves if not handled properly. And there's a whole bunch of skin tightening devices out there. I like to use one that goes beneath the skin at the time of the procedure. Now, so we'll see you back, make sure it looks good, then we wrap you back up and we send you home. At home, you'll unwrap yourself 48 hours after your procedure, and we give you, it's like a little neck sling.
I call it a face bra.
Face bra, right. For my male patients, I call it a neck sling. Yeah. For the women, I call it a face bra. But it's a little sling. We ask you to wear that for about 2, sometimes 3 days. So we do this a lot on Wednesdays and wear it through the weekend.
Right.
And you'll be return to work on Monday. And then you wear it at night. Now, if you're just doing liposuction alone, I always tell the story. I had a lady that came in and we scheduled it, we did it, and I saw her back at 7 days, and she was like, "Oh, Dr. Weiler, I look great. And I'm so happy because I'm getting married next weekend."
Oh.
I'm like, what? So she looked great. I didn't know that. Yeah, she didn't tell me that. Yeah. So I tell patients recovery legitimately can look really good in 2 weeks. Now, if you're adding one of these skin tightening devices, it can take a little longer because for them to work, they're adding heat and they're adding inflammation below the skin. So on those patients, we have to kind of hold their hand for a couple of weeks. they're going to be a little more swollen. They're going to be a little more lumpy, bumpy.
Yeah.
They're going to have some issues. They're going to have some concerns. And they have to understand, because that inflammation actually increases for 6 to 8 weeks.
Inflammation is good, though, in that
It is
area
good.
whenever it's heating and contracting.
It is.
So,
In the long term, it's good. That's
long
how I tell
term,
them.
yeah.
Young 25-year-old girl can come in, get liposuction, look fantastic in 2 weeks. Patients, early 40s, they're going to need that skin tightening device. And so, they're going to be more of 6 to 8 weeks before they have a big smile on their face. So it really just
When
depends.
does the stitch come out?
Stitch comes out at a week, 5 to 7 days. Wraps come off, all day, every day at around 4 to 5 days. You wear it for 3 weeks at night, and then it continually improves. This is a sort of, I tell ladies and guys, a lifetime improvement. If it's just fat, that fat's gone forever. It's not going to regrow, right? We're taking about 85 to 90% of it, right? It's gone forever. If it's a fat and a skin laxity, we can't stop gravity. We can't stop the aging process. So the skin will continue.
Can't stop the collagen loss, yeah.
The skin will continue to age, but the fat's never going to come back.
So we have a lovely patient coming on, right?
Yes, we do. This is a patient that's had both liposuction, and we'll talk about specifically about the brand of the skin tightening device when we get her on here.
Yes.
But she did have the skin tightening device at the same time, and she really had a great result. A younger patient, and we'll kind of talk about her recovery, the procedure, and the process, and we'll kind of go through that because we love to talk to real patients.
Love our patients.
All right, guys, we're going to cut to a break.
From Botox to tummy tucks, we provide patients with real confidence. Weiler Plastic Surgery. Something real.
I wanted to lose weight, and Rejuvime Medical made it easy. I did lab work and then a one-on-one consultation where we talked about goals and a treatment plan, and I started losing weight within a few weeks and was down 30 pounds in 3 months. The nurses and the medical providers made me feel comfortable, and I'm the most comfortable I have ever been in years. My name is Parker Ramirez, and I want to tell everyone I know to change their life and to get started now. Rejuvime Medical is the best option because they'll be at your side the entire way.
All right, guys, welcome back to the Consult Before the Cut. We'd like to thank our sponsors, Rejuvime Medical, the age-defying clinic specializing in GLP-1s and hormone management. We'd also like to thank Weiler Plastic Surgery Clinic, your South Louisiana aesthetic provider. Both great companies and both great clinics all throughout South Louisiana. And Taylor, we have a special guest, a patient with us today, right?
Patient, employee, the one and only Destiny.
Yes.
Destiny is a scrub tech in our operating rooms.
Surgical technologist,
Surgical
right?
tech. For how long
Correct.
have you been with us?
Almost 5 years.
5 years. So we get to get up close and personal with her. Let her tell us a little bit more about her journey and the process that she has gone through.
Right.
And I know you are the best patient because you see everything
I
firsthand.
do every day.
So
Every
tell
day.
us, start from the beginning.
Let's say with what I'm going to introduce with what she had done. And
Okay.
I'll kind of, so Destiny had submental liposuction with, we can call it Rejuvime by J Plasma, I think is what the company likes us to say, which is an energy / skin heating device. Correct. And we'll get into that. But
so that is what he was talking about earlier. The skin tightening secret with liposuction is the Rejuvime with J Plasma, and you use that quite a bit.
I do. It's one of my favorite things to do. We primarily use it in the submental area. I do use it on the arms. It can be used in other areas to create skin tightening, but those are my two home run areas.
Home runs. Yeah. So tell us your journey.
So being in the operating room every day, I get to sit there and do the chin lipos with them. And that's probably my biggest concern with myself. Taking pictures, you see the chin. So I'm like, oh my gosh, I need that. Being a scrub tech, we can't always have surgery because we got to be in the OR.
It's like being a masseuse. You give a massage, he's not getting it, right?
So I originally,
I'll go with Botox. I never get to get Botox.
I know, because you're the one doing it. So I originally started out with the Kybella. I did one treatment of Kybella. It actually did work, but it didn't give me the quick results that I wanted. So I'm like, okay.
And Kybella, for those of you, is the needle injection.
Yes,
right?
it's like she said, it's like a henna tattoo. They do an outline on your chin, inject you. It's super quick. It's not painful at all. It did work, but I feel like I would have needed multiple sessions. So I decided, since I had the opportunity, just to go ahead and get the submental lipo or chin lipo. So that's what I did.
Can I ask you, what was your impression, or what was your post-op course with Kybella? Did you have a lot of swelling? Did you?
Yes. So immediately, like Taylor said, I look like a bullfrog.
For about 48 hours,
Yes.
right? Yeah.
So I was swollen for a little while, but it wasn't bad. It went away fairly quickly. I could tell a small difference, but I feel like seeing chin lipo all the time in the OR, you could tell a difference right away, and that's what I wanted.
Right.
Yeah.
Right.
So
did Kybella re-consulted with him after?
did.
And
Yes.
How long
what
after
was,
the Kybella did we?
I think
Talk about
around 3 months after.
Okay.
what was your process procedure-wise? So day of.
So day of, I actually worked, and usually patients come in, like he said, we give them Valium and Ativan,
Right.
and if they need to be more comfortable, we'll give them another Valium. So it requires a driver because they're super sleepy. Well, I worked all day, and I didn't have a driver, so I decided to do it with no meds.
Straight local, we
Straight
call it.
local.
Straight
so
local.
only the tumescent, which is
Right.
the lidocaine and epi in my face.
So we did numb you.
Yes.
We did numb you,
So I
but
walk
we
in
didn't
the
provide
OR.
any sedation. So, and Destiny, you're tough. I mean, look, Destiny's a tough lady, and we do have patients. We do this kind of stuff under straight local.
Right.
Yeah.
But most of, and some of it's because you see it every day. So Destiny knew exactly what was going
Right.
to happen.
Yeah, I knew
So,
what to expect.
Right. So whether
Yeah.
you were sedated or not, like you knew it.
Yeah.
And so she took the option of, not getting sedation. For our typical patients that are nervous or just, 97% of our ladies do take,
Right.
it can be one pill. Or guys. So not what I'd necessarily recommend, but you're a special exception.
Yeah.
Yeah, I
you
get
knew
to
what was
see it
going
every
on.
day, so
Right.
I knew what to expect. I wasn't nervous or anything.
Right.
So I walk into the OR. Like he said, they clean you up real good. They put a little drape on me. I'm under a warming blanket, so it's super comfortable. He injects the tumescent, which is the lidocaine with the epi, and you feel the initial stick of the needle, which isn't bad. It's
Right.
like a little prick. And he does it to where, like, he sticks you, and then he'll stick you again where you're already numb.
Right.
So I only felt that one stick. And he just kind of fans it out everywhere.
Mm-hmm.
And your face is super swollen from the fluid. So all
Yeah, you
around your
feel-
lips
yeah.
get numb. So it's like really hard to talk. But your face feels a little heavy. And then after that, he'll let you know, like, hey, you're about to hear some stuff. It's just the suction. And he inserts the cannula, which is super small as well. And that's what.
Could not feel that.
No, could not feel
Okay.
it. My whole face was super numb. Couldn't feel a thing. And you can hear the suction, and you could feel him pushing and pulling, but there was no pain at all. And
Wow.
that didn't last too long. Probably, I got a good bit of fat out, but it
Oh,
didn't
yeah.
last long at all.
Did you have J plasma or Renuvion at the same time?
I did. So as soon as he finished sucking all the fat out, he did the J plasma. So that's
And you were actually one of our first patients to do it, right? Because we were testing this new device.
right.
Oh,
Because
yeah.
we currently were using another device.
Right.
Yeah.
And this was an upgrade. And there's lots of skin tightening devices out there. I believe that the J Plasma by Renuvion or Renuvion by J Plasma, however you say it, is the best device to use with liposuction. It does go beneath the skin after we remove the fat. So it's similar to it is a cannula that goes beneath the skin. And the way it works is that it passes an electrical current. That electrical current creates a little spark and a heat. And then it actually injects helium where that little spark is, and that helium ignites. Helium is a combustible gas, and it actually ignites beneath the skin. I call it almost like a little bit of a blowtorch type effect.
Okay.
Now it's scary.
You can't feel it though.
can feel it.
It's heated, but
It's-
it's
yeah.
not uncomfortable.
Right.
So it's
You
a
can't-
controlled blowtorch.
It's a
Right. You
controlled
can't
blowtorch.
feel the blowtorch
Yeah.
inside of your face.
Yeah, and what it does is it quickly elevates the temperature, and then and it quickly goes away because that gas burns so quickly because it's always moving, and it's a quick burn, so it works really well. And that's not really the best scientific explanation for it, but it's very, very effective.
Easiest for us to understand.
Easiest for us
Yeah.
to understand. I like to make things simple, and so
Right.
and we pass it anywhere between 4 and 6 times underneath the skin, and you can actually see that skin. You can feel it contracting, and you can
Yeah.
see the gas too.
Yeah.
Which is odd.
Wow.
As a patient, I can't feel the heat.
Right.
But as a scrub tech, you could see
Yeah.
the skin actually moving.
Yeah.
Yeah.
And it's painless. The only thing you can hear is the gas bubbles.
The
but
gas
other
bubbles.
than that,
So you heard him as a patient?
can hear
Oh, really?
it, yeah.
Okay. Yeah, it's interesting.
it's very gassy.
So then obviously you had a couple of stitches.
I did. So I had one under my chin and then one under each earlobe.
Okay.
No scarring. Those came out a week later. So
So
at
how,
the
and when we
end,
wrapped you up afterwards,
yeah.
right?
So right away after the treatment, you can tell a difference. You're super swollen, but I could still tell like I was flat underneath my chin.
Wow.
So he wrapped me up really tight with Coban, and the next morning, they unwrapped me, and the difference was amazing.
Yeah,
Wow.
we're probably showing your pictures for those of you watching.
Yeah.
Destiny had you just genetically.
Mm-hmm.
I mean, I'm not trying to be weird. You're an attractive lady. You got nice thick hair. You look great, but you did have one of your biggest issues is
Right.
you just naturally
You were the
collected,
most conscious, right? Yeah.
You know, you naturally collect fat beneath your
Right.
chin. And it was an issue, and for you, it made a dramatic difference.
Yeah.
It really did instantaneously.
Right away, but then the next day you can really tell as
Right.
soon as that tight wrap came off, you could
Right.
see there was nothing there at all.
Now you have pretty skin too, I'd say. So because you're still in your 20s, is that correct? Or
I'm 32.
32? Are you really? Okay,
Yeah.
I thought you were. I'm not trying to.
It's the Botox.
I always underestimate.
Botox filler and lipo, yes.
But you got very pretty skin. You have fair skin, but you have thicker, pretty skin. And so we did this maybe a year and a half ago, year ago.
Back in February, so almost a
Almost
year.
a year.
Yeah.
Okay. So you're kind of that like middle point patient to
Right.
where, hey, you want the best result. I recommend both. Could you have gotten away without the skin tightening? Possibly.
Yeah.
In your 20s, you definitely could have gotten away without it. In your 40s, you definitely need it. So you're on that lower end, but I think it gave you a transformative result. And we're showing you pictures. It really changed the shape of your face.
Yeah, it did. So after they took the Coban off and I got to look at it, they put me in the face bra, like Taylor said. So I wore that as much as I possibly could for about 2 weeks. Probably after a week, I would wear it less during the day, but always at nighttime.
Right.
Right.
Right after 2, they gave me an ice pack that I would wear about an hour on, hour off, and that would just help decrease the swelling.
You felt like you had a
right.
lot of swelling afterwards, or not really?
I didn't.
You
I was
If I remember,
swollen
you didn't.
as soon as
Right.
the tumescent kind of went away. I was
Yep,
fine.
yep.
There was no swelling.
Tell me about pain.
No pain at all. So I did not get prescribed pain meds, but I also did not have to take Tylenol or anything.
Really?
No
Yeah.
Tylenol, no ibuprofen, nothing. It was
It is a
completely-
Okay, that's
relatively
impressive.
painless procedure. I
Wow.
would say.
So I
for the
didn't
most
have
part.
Valium and I didn't take Tylenol.
So when did you return to work? Obviously,
The
you're
next
in this
morning.
industry. So you worked
So-
the next day.
That's the rule.
You want surgery, you gotta come back.
That's the rule. If you can come
No,
back.
I had the procedure about 5 or 6 o'clock and was at work for 5 a.m. the next morning.
You tough.
Okay, that's impressive.
Uh,
I don't know
The
about that.
recovery
Wait.
was super easy.
Okay.
Like fast and easy, and the results were immediate.
Yeah.
So it's something that I recommend to everybody. My friend actually sent me a picture yesterday. She bought like a chin strap off of TikTok, thinking it was gonna get rid of her double
Another
chin.
common myth.
I'm like, take that
Come
off.
in and do
Well,
it.
a lot-
go get it.
Hey, can I be
yes.
honest? A lot of the issues is there's a lot of myths and gimmicks and providers out there that are make promises they can't
Right.
fulfill, right? And all right, so let's say you buy a $300 device off Amazon of LED lights, right, to help melt the fat.
Yeah.
It's not going to work.
Right.
And then you go to an esthetician somewhere that's not affiliated with a plastic surgery clinic, and they tell you that they have this device they bought for $5,000. It's not going to work. Cool sculpting is an expensive device.
Right.
These are very expensive devices, and so you can waste a lot of money.
Right, because you never know how many sessions you're gonna need.
A lot of money and time. That's the biggest thing.
I
think
want
that,
results immediately.
Right.
I don't want to spend all that time and money having multiple sessions.
Yeah, and not see the
And
results.
you never know
Right.
if it's going to work or not. So
I
I
think-
always recommend chin lipo because it's immediate.
Right.
It's a quick recovery.
Right.
You have it, you're done.
Yep.
Right.
Yep. Moving on.
And you're a surgical technologist. So.
Yes.
So
what you do.
provider selection, you just kind of, said a little bit about that, but
I think it's in, look, these are as aesthetic procedures and plastic surgery becomes more and more popular, Botox and fillers are so accepted. And we'll talk real quick about some fillers that she had in the chin area that helped.
yes, that's
But as you get these items, there's more and more options out there for people, and there is no law that says, you can't basically say whatever you want and advertise or tell people, right?
Right.
And so it's really important when you do this that you go to somebody, and the way we've structured our company at Weiler Plastic Surgery is, we have all the way from estheticians all the way up to plastic surgeons, and everybody is aware of what everybody else does. So if somebody comes in and they have a skin problem and our estheticians can take care of it and know they can do a good job, they sit there. But if they know that more is required, then they elevate them to either an injector, a physician extender, to all the way up to a plastic surgeon. And so it's important that you go to somebody that has everything.
Absolutely.
All right, talk about the filler really quick. So you had some filler done too, correct?
Yeah, I did. So after everything settled and I was fully recovered from the chin lipo, I actually got a jawline filler and a little
Chin
cheek filler and chin filler.
Yep.
And that really just snatched my jawline, giving me just a perfect little jaw.
Yep.
Yeah.
And it really looked good with the
kind of think it finished.
yes,
finished
it off.
Finished the
Right.
look.
Yeah.
Yes.
Right.
Kind
And
of polished it.
you didn't need a chin implant, of course, but just a little bit more volume, like you did, I think really looks good.
Made it
looks
pop.
really good. Yeah.
Gorgeous.
Thank
Good.
you.
Anything you wanted to add? Any tips for somebody watching out there?
I think if you're unhappy with your chin lipo is the way to go. As
agreed.
much money as you're going to spend on multiple sessions doing other stuff, you might as well spend probably the same amount that you would throughout your sessions and just get it done.
Get it done and get the results.
Yeah.
Yeah. I agree with that. I think it's transformative, and I think it's probably one of the best things that we do.
Yes, I agree. We do a lot of chin lipo.
Absolutely.
So, Submental lipo, gold
Submental
standard.
lipo.
Gold
There are
standard.
tons of other options. Weiler Plastic Surgery is all encompassing. So we offer all the things, but that's probably our gold standard to give you the results the quickest, easiest. So yeah, come and see us for a consultation. Thank you for joining us
you.
today. Awesome consult with Destiny, and we
Yep.
really appreciate you coming on.
No problem. Thank y'all.
All right, guys. See y'all next week.